Thanks for tuning into the Becker's podcast. I am Molly Gamble, and today I am delighted to catch up with Gene Woods, CEO of Advocate Health, the fifth largest nonprofit health system in the U.S. Gene, welcome. Thank you so much for being our guest today. How has the day been so far for you, and where does the podcast find you?
It's going well. So welcome. It's good to see you again, Molly. I actually just got back into Charlotte from coming off of a 3-day Advocate Health Board cycle last week in Chicago, as I'm getting to know the Midwest colleagues there even more and meeting with some key leaders. I had a chance to spend some time with Illinois Governor Pritzker, who's been a friend to Medicaid and things of that nature. But I'm back in sunny Charlotte, although it's a little cold. And by the way, we're actually now the third largest not-for-profit, I think, if you look at the beginning of this year. So I wanted to state that for the record.
Oh, thank you so much. I love a real-time fact check.
Yeah.
I'm not even going to go back and restate that. It's third, not fifth. I was mistaken. Thank you, Dean. You mentioned Advocate Health. We are coming up on the 1-year formation of the system, the combination of Atrium and Advocate Health that extended both systems' footprint into 6 states, a $27 billion enterprise. How would you describe this past year to another health system leader, Gene?
Yeah, well, December 2nd marks the actual official 1 year of our anniversary of our coming together. And I would say a couple of things. All of us have gotten into this profession because we wanted to make it the best it could be for our patients and our communities. And in that regard, I would view this year actually as one of the most invigorating of my 30-year career. For one, it's been really inspiring to see how the cultures of the teams have really come together in the Midwest and the Southeast. And they're learning from each other, sharing best practices, and figuring out how we care better for our 6 million patients. So there's a lot of excitement, a lot of energy around the system. And the other things, if you look at, given the headwinds that the field has faced on financials and things of that nature, we set out this year with a very specific synergy savings target, and we're already achieving about 200% of that. And so it's going to end up to be a very solid financial year for us coming together. And so we're seeing the benefit of scale even faster and in larger ways than we had even anticipated. And recently, earlier this year, Fitch and also S&P rated our system AA and stable. So in the face of all these headwinds we're all dealing with, it's nice to have a few tailwinds that come from being together. But the final thing I would say around that is, there's a lot of big strategies, a lot of big integration savings that we're driving, but it still comes down to, one patient at a time and making sure that we're providing the best quality and compassionate care. And that's probably what I'm most proud of, because all of our financials metrics are going in the right direction, but more importantly, our quality metrics are all going in the right direction. So it's been a great year.
Most invigorating of your 30 years in healthcare. I mean, that's quite a banner year, quite a
Yeah,
review.
it has been, and part of it is just you see our leaders just tackling big problems and big challenges, and doing so with a renewed energy that comes, after the couple of years that we've dealt with the pandemic. To have a compelling vision to strive for is something that's created a lot of excitement.
Mm-hmm. When you talk about big challenges and big needs and big problems, I wanted to go there. The MITs, the most important things that are really taking the most of your time and energy today. I think that's a great kind of look at how the past year has been. But in this current moment, what's on your radar in terms of MITs right now, Gene?
Yeah, well, the majority of my time right now is as much as anything is on the integration, but really is on crafting the framework for our 2030 strategic agenda, if you will. And there's a number of important components on that. One is we have launched this new innovation district called the Pearl in Charlotte, and we've recently signed an exclusive arrangement to be the ERCAD's exclusive North American partner, if you will. And ERCAD is based out of France, Strasbourg, France, and they are the leaders internationally in AI and robotics. And so this idea of innovation is a big focus for us. We've really recently committed to having one IRB, Institute Review Board, for the entire system for all 68 hospitals. And on that platform, we are building what we're calling the National Center for Clinical Trials. And so we'll have one center essentially for the whole system. So if you need access to the latest clinical trial in rural Wisconsin or downtown Charlotte, uptown Charlotte, we call it, you actually have have access to that. So we're putting the foundation for that in place. We're also building a medical school that will be operational in 2025, and it'll be the first carbon net zero medical school. We think certainly post pandemic, it may be in the country. And so those are some big MITs, if you will. The other thing I will add is that we will be launching our National Center for Health Equity, and we really intend for it to be one of the largest repositories for best practices interventions to eliminate disparities in the country. So that's going to inform a lot of the work that we have to do and are committing to between now and 2020 and 2030.
Amazing. I have to say, just the tack on, we're also building a medical school. I mean, these are major initiatives you're discussing. For listeners who might be less familiar with the Pearl, what's like the best quick way you would summarize that new infrastructure and center in addition to Charlotte?
Yeah, you think about an ecosystem that has a medical school. It has, for example, we announced a partnership with Siemens that will be on campus. You'll have nursing students there. We're building a big, also clinical new tower. And you can imagine nurses, entrepreneurs, physicians, scientists, all working together on the latest medical device or surgical technique. And so it's that sort of bumping into each other and sharing best ideas that we're creating this space. Certainly it's going to be in Charlotte, but we're connecting with our IQ Center, for example, in Winston-Salem, which is world renowned in regenerative medicine, and then we're spreading that out throughout the entire enterprise. And so innovation is really core to what we are becoming. We all know that it took 1 year to really bring the vaccine into play. That's the fastest it's ever done in humankind. And so we're taking those lessons in terms of how we can accelerate new discoveries through creating these combination of colleagues around the table.
I love that. I love that description way of thinking about it. Well, in addition to everything you just shared, Gene, in addition to, you have managed your time in a way where you've authored a book as well. It's titled Health, Hope, and Healing for All. And in it, I've had a chance to read it and preview it. In it, you write about the challenges healthcare systems face, and you highlight the urgent need to ensure access to healthcare for all. Health equity is a strong through line in your book. Before we dive into the contents a bit more, I'm curious, what was the deciding factor for you to take pen to paper and author a book?
Yeah, well, as we were going through the pandemic that we were all dealing with daily battles, there are a few on my team said, you should keep sort of some notes because we don't want to forget these times, and there could be lessons in them for the future. So I would sort of, at the end of the day, most days, if I was not overly exhausted, would jot down some notes in terms of the decisions that we had to make that particular day. And those ruminations and those notes actually ended up in the book that you had a chance to preview. And I also just wanted to spotlight and never forget the courageous teammates and what they did from the clinical front lines, building new community partnerships, the behind the scenes operations that our teammates were engaged in. And that, obviously led me to say all of the proceeds from the book will go to supporting those very teammates. But also, I talk a lot with my team about what's your personal why. Don't forget your personal why and your professional why. And so in that, I tell a little bit about my story and what's informed my why. So all of that is kind of contained in the book. The other thing I will say is, we know that healthcare is ailing and in need of some serious fixing, if you will. And so I talk about some prescriptions for the future in terms of how we can fix healthcare that hopefully will spark some conversation.
Great. I'll give you a lot of credit. I think amid the demands on your time and energy in the pandemic, to take time still to document and almost be a good journalist with yourself about what you were seeing and experiencing. It's interesting how our memories can trick us in hindsight, right? So to have that actually written in those moments it's really powerful. One of the themes that comes up a lot in the book, and rightfully so, is the healthcare workforce. And I wanted to spend a moment with you on that topic. I'm curious, from your perspective, what would you say is a dimension of the healthcare workforce crisis that you feel is not as well represented or prioritized as it should be? What are we at risk of overinvesting in or even underinvesting our attention in if we're not careful?
Yeah, I would say the number one thing that comes to mind and what keeps me up at night is, just workplace safety. Data shows that the American healthcare worker is now suffering more non-fatal injuries from workforce violence than workers in any other professions, including law enforcement. So that's the thing that keeps, I know many of my colleagues listening also up at night, and that's why we support things like the SAVE Act, Safety from Violence for Healthcare Employees. That's a bipartisan approach to make sure there's stronger legal penalties for those that knowingly and intentionally assault or intimidate hospital employees. So we're focused on those areas. Obviously, internally, we have this many different initiatives. One that comes to mind is trauma-informed care and peer support. So we have about 1,600 trained teammates that provide peer-to-peer ambassador support when one of our teammates is experiencing violence. Obviously, we have EAP resources available as well. So that, to me, is every single day is front and center for myself and the team. In terms of other areas that we focus on, this whole AI transformation, right? We're part of this ACTS Copilot that's an AI-powered automated documentation solution that creates clinical notes from patient conversations. It's almost like having an automated scribe write with you in all your visits. And we're finding amazing results in terms of accuracy, the time it's saving clinicians. And we're just in a pilot, and these physicians are saying, don't take this away from us. And so I think a lot of the work that we're also doing with respect to workforce is that engineering, that re-engineering, because a lot of times, when I talk to my nurse colleagues, they tell me, hey, in some ways the nursing profession in terms hasn't changed much in 30 years. It's still overly task oriented. And so they want these solutions to help them spend more time at the bedside rather than completing a bunch of forms. So we're really giving a lot of thought, and we need to invest a lot more time and resources in terms of that workforce redesign.
Gene, I think you hit on AI and then the safety piece of workplaces. And I think even in conversations recently with children's hospital executives, they've noted how the increase in violence in children's hospitals has even presented such a challenge in terms of recruitment, retention. There's more turnover because people aren't equipped, or they weren't expecting that when they chose that profession. So happy to hear you're supporting the SAVE Act. I know it's in the Senate now. It was introduced a few weeks ago. Bipartisan support, like you said. So I hope that there is some resolution there quickly to get you more resources in the policy lane in addressing that problem.
100%. Yeah, I think that's the piece, and I think I appreciate that's a bipartisan piece of legislation, because I think it's something that affects the most rural parts of our communities to the most urban.
Mm-hmm, mm-hmm. Well, moving on just a little bit, health equity. Like I said before, such a strong through line in your book. In your author's note, you point out that health systems cannot close disparities on their own, but they really need strong partners with government officials, business leaders, community organizers, religious, civic organizations. And I'm curious if you can share your favorite story or an anecdote of how you've seen any combination of these stakeholders combine their efforts and achieve health equity improvements that would otherwise not be attained.
Yeah, we're dealing with some really, really complex multi-generational issues in all of our communities. And so I do, to emphasize the point you made, I think anything that is to be sustainable requires this combination of partnerships. And my favorite story is one of my good friends is the CEO of Honeywell, and we were taking, in the middle of the pandemic when the vaccine was now getting out, we were taking a walk on Sunday, and he says, what's the issue with distribution? How come I'm hearing all these stories of people waiting hours and hours in line? And he says, I got a meeting with the governor. Do you want to join? And so we can put together a plan to figure out how we can get as many shots in arms as we can. And so we had our teams meet Monday and Tuesday, met with the governor on Wednesday. We had David Tepper, who owns the Panthers, in on it. We had the owner of the Motor Speedway. And really within a week and a half, we'd hatched the plan to really put our first weekend, about 25,000 shots in arms around the Motor Speedway, where the shots actually were given when you stopped at the pit stop. That's where the people there. And we leveraged all of Honeywell's technologies in terms of efficiencies and processes. And we worked with the county and the city government. And I think we held among the most successful mass vaccination events in the country, putting shots in arms every 4.5 seconds. And it was those relationships that we forged in the fire of, in the crucible of the pandemic that have continued to this day and continue to strengthen. We're working on pre-K education, on homelessness, on how to improve our public schools. And it's that constellation of partnerships that's continuing to work together on these big societal issues. And none of us could have done it alone. And I think in this time of a lot of divide in this country, and I think if we're all serving the same community, whether you're elected official, whether you're a health system, whether you're a business. So I think the more that we can remember that, the more we do right by our own respective organizational missions.
Mm-hmm. That story. So a walk on Sunday, right? And then you prepped your teams Monday, Tuesday. Wednesday was a meeting with the governor. And then when was the vaccine at the
was
motor
a week and a half after that. The great thing is we had 30% of the folks that we vaccinated were people of color, right? Because there was a chance. So we worked with the churches, make sure that there was adequate transportation from church parking lots to, for example, Bank of America Stadium or the Motor Speedway. So we really made sure we took care of the transportation, which is another logistical feat, to try to organize in the same time, coordinating with the county, with the sheriff departments, with the police departments, and so forth. So it's and it shows that we should not forget that in the pandemic we made decisions that sometimes would have taken us months and months and months in a matter of days. And I think that's what healthcare needs now. It needs that level of agility, rapid cycle decision making, because things are changing pretty darn quickly.
I wanted to highlight the timeline of that because I think in health equity work, so often you're prepared for the long haul, and it is a long haul. It's going to take time, but I think as that story shows, with creativity and some of these other synergies that were really palpable during the pandemic, I mean, a week and a half, that is amazing.
Exactly. And I think you make the essential point. We shouldn't orient our brains to say, okay, this is going to take 5 to 10 years to fix. If the right people come together with the right will and the right level of talent, you can literally move mountains. Several years ago, we were recognized by CMS with an equity award. And really, a couple of years before, we had done an equity data analysis of communities and found out there was a high incident of colorectal cancer among Hispanic males. So we instituted a pretty comprehensive plan and reduced the incident by 62%. It didn't take us 5 years, 10 years. So it was just everybody was aligned in terms of that single mission. And I think there's a lot of lessons to be learned in that in terms of post-pandemic, if you will.
Mm-hmm, very much so. Well, speaking of lessons in post-pandemic, a really painful time for the country and for people, May 2020, the murder of George Floyd, such a tipping point for a sea change in the US and also for Atrium Health, which it was then Atrium Health as an organization, and you as a leader, as you detail in the book. This was really a moment when you as a Black CEO opened up about your experiences with racism and discrimination and shared some pretty difficult stories about your life that you had previously kept to yourself as you were progressing throughout your career. And Gene, I'm just curious if you could recall the headspace and the emotional states that you navigated when you were sharing this side of your lived experience for the first time with colleagues. I think that's such an important moment, the stories being told themselves, but also how that could have affected or changed you as a leader and a person.
Yeah, I mean, I think, as you said, I never really spoke about my own experiences along those lines in a work context because I didn't want it to be about me. And I was mostly focused on creating safe spaces for others to share their stories. But when that happened, one of my leaders, Keneal Coleman, came to me and said, I think you probably should take this opportunity to tell your own stories and your own incidents with discrimination and so forth. And so I had a chance to do that. In a number of forums. And the surprising thing for me, and perhaps in a really good way, is that it allowed others even more latitude to tell their stories, right? So we spent a lot of times hearing, and it's not just Black and brown, but our allies and so forth telling their stories and what they have seen and how they've grown up and things of that nature. And, I tell stories about my dad also, who didn't talk much about it to us as well. So I tell a story about him really bunking with in the Navy on the U.S. Enterprise with somebody who was white and how that dynamic changed both of them. So I think my ability or at least I was asked to share my own story, and I think it helped the culture in terms of creating even more safe space. And people certainly want to see their leaders be more human, and I would dare say more vulnerable. And so I think this human side was important for me to show at a moment where a lot of people were hurting.
Yeah, very much so. Vulnerable and multidimensional. And I remember we were fortunate enough with Becker's to be able to play a small part in some of those engagements in the aftermath of George Floyd and with you speaking. But I would encourage our listeners with the book to really focus on that chapter. It's illuminating, and I think a really important one, Gene. I think in light of all of this that we've been discussing, all the topics in your book, one overarching theme is that even the MITs you shared with your system right now, you are really working as an organization towards some pretty lofty goals. How do you, as an individual, as a leader, manage your patience, incremental progress, persistence? When you're working towards something so big, how do you go about the day to day?
Yeah. Well, I think you kind of have a sense, Molly, that I don't believe in incremental progress. That's not how I'm wired. I believe in big, bold leaps into the future. That always comes with some risk, clearly. But I think that incrementalism at this point has much bigger risk on what we do as healthcare providers. And I think the best lever a leader has when they're driving big change is really to create that compelling vision, that buy-in. There's a quote that I heard that make your vision so clear that your fears become irrelevant. And so how do we really think about not necessarily the burning platform in traditional sense, but really that vision? What would we want to create for our loved ones in the communities we serve? And let's do that. And some of those topics that I alluded to earlier, we want better, more innovative care close to home. We want people to be taken care fairly. We want to make sure that the community feels embraced, that it's not just about care inside the walls, but outside of the walls. We tell the story about Sabrina, who maybe is a little girl in public school who dreams of being a physician in fifth grade. What are we doing now to have them shadow our pharmacists or doctors or nurses so that she can do better in STEM classes, so that then she has a pathway to medical school, maybe the medical school that we're building. So all of those are big ideas, and I think when we articulate that to our teammates, they get excited about them. So I think that's it's the compelling vision that I try to every day figure out how to tell the story about.
I have to say, I really admire how unapologetically bold and big your vision is, how you're not trying to caution or bookend it with it'll take time and of course, all things are executed with metrics and one piece at a time, taking a bite of the apple, one bite at a time. But I think, Gene, it's so important, like you said, for leaders to really ensure that vision stays front and center. As we wind down here, I'd be remiss if we didn't spend just a beat on your music. You are a serious musician, Gene. I was struck by the book to understand that your interest in music did not really develop as a recent hobby. It goes back years and years. It was something that you actually put on pause to pursue a career in healthcare. Can you talk about how it's been revitalizing this passion in recent years?
Yeah, well, in the book I talk about when I was 10 years old, 9 years old, my parents bought me my first guitar and amp, and I was the first to go to college. They didn't have money to afford to pay for college, and in fact, they forewent 3 months of rent in order to afford my guitar and amp. But it was the biggest investment they could have made in my education, because that's how playing in bands is how I put food on the table and pay the rent, if you will. But I've always kept it as a hobby, and during the pandemic, we do a talent show that is, it's an incredible talent show. We call it Atrium Has Talent. On November 17th, we'll have our first Advocate Has Talent show that will broadcast, and it has amazing talent from all over the system. We narrow it down to the final 12, and we have judges, and we have a People's Choice Award winner. But it is really something to see. But in 2020, they asked me if I could do a video song, and I did a video of a song I wrote when I was 20 years old called "Not Enough Joy," and it seemed to resonate really with the teammates in ways that I had not anticipated. Got a lot of feedback in terms of, we really appreciate you connecting with us through music, and so that was sort of my reentry, if you will. The other thing, we're doing a lot of research on music and healing. how it's improving gaits in Alzheimer patients, and how it's improving a whole host of conditions, certainly reducing stress and anxiety and trauma. And so I think there's a really natural connection that I'm, that I'm more comfortable with in terms of bringing music into the workforce, because we have researchers that are studying this every day and really sharing how in an evidence-based way it's improving healing. And I recently, Molly did they did a segment on the Today Show, and I talk about work-life harmony, and that's really what resonated most with folks. I don't talk about music and work in terms of work-life balance, because I don't think you can ever achieve balance, really. That's an elusive goal. But if you're what you're doing during the day and what you're doing at night, if you have shared values or get some joy, similar joy from both, and I think you can harmonize this, and that's what really music has been for me.
I'm just struck. Everything we've talked about, you have it so well connected in one way or another, if not numerous ways. It connects back to something else, Gene. So to hear that music is even now being studied as part of healing, which there's existing research there, but to build on that, that's incredible. That's so great. As we wind down, Gene, what final message would you like to leave our listeners or viewers with today?
Yeah, I would say there's no better time to create the future than now. When I coach and mentor a lot of young folks, and I said, things are changing so fast that the value of experience, if somebody's been in the field 30 or 40 years, doesn't have as much currency as it once did. So bring your fresh ideas, because we need new thinking. And in that way, it's a very exciting part of it's a very exciting sector to be part of. As I said, this past year was one of the most invigorating in my career, and I'm hopeful that the years ahead will be even more so.
Well, congratulations, Gene, on 1 year as the bigger and better system. We also want to congratulate you on your book, and also are looking forward to having you join Becker's in April at our annual meeting as a keynote speaker. So another trip to Chicago in your cards, probably many more. Yeah. But thank you so much for your time and your generosity and what you share with us and the healthcare community, Gene. We greatly appreciate it.
Thanks, Molly. Appreciate you too.